think we're live. Awesome. Guys, today's live session, I'm going to kick it off talking a little bit about anterior pelvic tilt and herniated discs because it is something that we get time and time again, and hopefully this will help you guys understand a little bit more about this concept of anterior pelvic tilt, which is basically when we are in that kind of position. And kind of circle around to why so many people get this wrong, because it's really, really important. The amount of people that used to come in clinically over the years when every single patient of the thousands of patients that have come through, where they'd come in and say, I've got anterior pelvic tilt, and we go, yeah, fair enough, based on my training as an undergraduate osteopath. At the time, I can see why we're saying that, right? That training was flawed, but we'll get to that in a second. And then you go and do the imaging and you're like, looks like you don't actually have an anterior pelvic tilt. Looks like you have to the contrary. And you start to realize you can only do this so many times and have that realization before you start going, physical exams suck. And as we discussed yesterday on the live, when we talked about measuring the effect of belts on restricting lumbar flexion, specifically at L4-5 and L5-S1, like we start to realize the severe limitations of physical exams. And 9 times out of 10, if not 99 out of 100, you've been told you've got an anterior pelvic tilt by someone who's looked at you. They've said something along the lines of your bum sticking out a little bit, your tummy sticking out a little bit, and you just need to, tilt round and everything's going to be a-okay. And hopefully this is going to make a little bit of sense for you guys and help you avoid the all too common case where people end up acting on a supposed anterior pelvic tilt, and it makes the whole thing worse. So first and foremost, why is an anterior pelvic tilt actually going to be a problem, especially if we've got a lower lumbar issue, right? And the main reason here is that when we anteriorly rotate the pelvis, we typically see a commensurate change in the rate of curve in the lumbar spine. So an anteriorly rotated pelvis will result in a hyperlordosis, and a posteriorly rotated pelvis will result in a flattening of the lumbar lordosis, meaning a flattening of the curve, right? So if I tuck my bum under, flatten my spine, and if I stick my bum out, I arch my spine relative to the neutral. And it's worthy of remembering that the neutral is a lordotic position, meaning there is a curve, right? The back is not supposed to be straight. It really should not be. So that's an important thing to understand. Now, if we create an anterior pelvic tilt of significant magnitude, then one thing we need to know is that the lumbar spine is supposed to sit on a slope, right? The sacral base, which is the slope that this lumbar spine sits on, you might be able to just about see on the camera that it's not sat flat. It's sat on a slight angle. The L5-S1 disc is a little bit of a wedge shape compared to the others because it's supposed to accommodate that angle, that slope that it's supposed to sit on for effective, normal, healthy alignment. Very important. When we do have too much of a slope, it does create a lot of shear, right? And the disc is designed to compress, not deal with that shear. So it doesn't like a true anterior rotation. So that is something to understand. It's going to put pressure on the facet joints. If we have things like spondylolisthesis and we have an objective anterior rotation of the pelvis in our standing upright position, then that is a problem. Sure, when you move into this position, if I go like so, I have an anteriorly rotated pelvis relative to the neutral, right? When I'm in a hip hinged position, which is a perfectly reasonable movement, I do have an anterior rotation of the pelvis, and that's worthy of, recognition, if you will. Recognition might be the right word, right? Because it's not to say that the pelvis can never go into an anterior rotation. And I'm seeing some of you guys are posting comments, so I will get to the comments in a second. We're going to be here for an hour, so buckle in, right? Hopefully it's going to be really helpful for you guys, and most of that will be on questions. But what all too often happens, so we understand why the anterior rotation is not going to be ideal. It compresses the facet joints. If that's the standing upright position, it's not ideal. The problem is we have to think about, well, what maintains normal, healthy spinal alignment? And it is really a function of the ligament imbalance between the ligaments on the front part of the spine and the ligaments on the back part of the spine. And they should be imbalanced in such a way that there is a lordosis, a natural lordosis, right? And that develops through our years of development from a child, right? When we're in the womb, we are a one C-shaped curve. And then gradually, it's so great when you have young kids because you see this happening, right? Obviously, it's not what every parent is particularly interested in, but obviously given the profession, it's really cool to see Evelina and Celestia, going through these processes of, and the way in which their spine is developing as they go into crawling, sitting, standing and walking and all that kind of stuff, right? Really, really cool. We develop these normal curves, and it's a function of the imbalance between the ligaments on the back and the front part of the spine. And what changes that alignment? That's the important point, right? Sustained stretch on those ligaments can result in changes in the curvature over a long period of time. And so we look at, well, what do we do that might put repetitive strain to increase the curve in daily life? And what do we do that might result in decreases of the curve? And you'll see, for most of modern life, everything we're doing every single day for extended periods is flattening the curve. It is eliminating lordosis, and it's putting us into positions of posterior pelvic tilt. And this is borne out in experience over the years, working with so much in the way of patients with imaging, right? Verifying these things, measuring them in a standing position. And you actually see that people don't tend to have an increase in lumbar curve. They tend to have an increase in posterior rotation of the pelvis as opposed to anterior rotation of the pelvis. And they tend to have, if any sort of alignment discrepancies, a flattening of the lumbar curve, not an increase in the lumbar curve. And so why is this mistake constantly made? Because people aren't aware of the limitations of a physical examination. What normally happens is something along the lines of this. You're stood in the clinic and you got some back pain and you stand there and they go, oh, look, your tummy's sticking out. And oh, look, your glutes stick out. And you see how this curve is really deep? Wow, look at that. That's such a deep curve. You've got an anterior rotated pelvis. Look, if we do a pelvic tuck, look now how it's nice and flat. That's great. And that comes from from a practitioner that just doesn't have the level of experience to understand just how misguided that kind of approach is. And the reason I say it's misguided is not to be disparaging. You don't know what you don't know. But they are taught at university, as I was taught as an undergraduate osteopath, that you can make those observations, but they are so poor and so inaccurate, and it's only having that humbling experience of seeing literally thousands and thousands of patients with physical exams and their load-bearing imaging, where we measure these things to the degree that you start to realize there are lots of illusions. Now, why are there illusions? Well, one of the reasons is the position of the engagement of the abdominal cavity, right? The engagement of the abdominal muscles is completely independent of the position of the pelvis and the position of the lumbar spine. I can engage, I can turn it off. I can engage and I can turn it off. Now, in this position, you might say, oh, I've got anterior pelvic tilt because my tummy's sticking out. But if I engage my midsection, now it is not sticking out. I haven't moved my spine. I didn't do that. I'm over-exaggerating. You guys get the idea, right? I just engaged. So the person where their tummy's sticking out, oh, you've got anterior pelvic tilt. They're just not engaging their core. And then when it comes to the buttocks, right? The buttocks sit here, right? They have no contribution whatsoever to the lumbar curve, because these two bits here, you can see very clearly on the model, they are not the start of the lumbar curve because the lumbar curve is in green. They are the sacrum. On me, for reference, those two bony bits are here. They're all the way up here, which means my spine is starting around about here. That's the start of my lumbar curve. You can't make any reasonable observations of the alignment of my lumbar spine. And the comment about the gluteal muscles is completely irrelevant to any comment about curve in the lower back. And so we end up creating these illusions that we are taught, wrongly so, infer the presence of an anterior pelvic tilt. And this is just simply untrue. And so you get tons of people who get told they've got anterior pelvic tilt. They all start doing crazy pelvic tucks, find it's not actually going anywhere, although the first instance of doing a pelvic tuck, like, it feels nice, right? It does feel nice. But there's no reason in the history, fundamentally, the way in which this person uses their body every day, most adults spending significant amounts of time sitting every day, would not suggest that they have been doing the kind of actions necessary to increase the curve in the lumbar spine and anteriorization of the pelvis significantly enough, continuously enough, and in enough magnitude to offset all the bad stuff they're doing, the other stuff they're doing, sorry, both are bad, but to offset the posterior tilting that they do every single day. So hopefully it makes a bit of sense. Guys, unless you have had, and we are very, very clear with members in the program in this, right? Unless you've had measurements with numbers, and that those measurements are significant, because you might have a slight increase of 10% of the anterior rotation of the pelvis, and if that's in alignment with a slight increase of maybe around 10% in the lumbar curve, that is not significant. Sometimes, unfortunately, we get, these scenarios where the chiro says, oh, you're 1 degree out from normal. Look at that, it's terrible. You're going to fall apart. I don't know how you came into the clinic today. You're 1 step away from everything breaking. And it's like, please stop with the hyperbole, right? There are significant ranges that we can all be in as normal human beings, and that's important to understand. But at the same time, if you haven't had these anterior pelvic tilts actually measured with imaging in the load-bearing environment, completely disregard those kind of comments because they're so inaccurate. It's not worth paying attention to. And equally then, the person that is struggling, you, for example, the patient that's struggling in pain, you're struggling to perform even the simplest of movements like a squat or a hip hinge without aggravation, or contain and control yourself during a dead bug, for example, without pain. You're the one that's supposed to be specific enough and skilled enough to be able to reduce that curve at the pelvis by 22.5% without reducing it by 37%. You don't have a clue. I don't have a clue. You don't have a clue. None of us have a clue. So the notion that even if we were actually accurate in that scenario, the notion that you're going to be given an exercise that's that detailed to actually correct it and not accidentally overcorrect it is really quite silly. So we're best off leaving alignmental issues alone unless we've had specific measurements. And then when you're doing it with someone who actually makes the specific measurements, they'll be able to guide you a little bit more, right? So hopefully that helps. Hopefully that helps. I'm getting a bit out of my chair talking about this, but it's something that, you know, we've had to wrestle with over years and years of this kind of stuff. But hopefully it helps. Hopefully it can help you guys. And that's one of the reasons why in the members area, we have members that upload their x-rays, their images, right? And we cover them. We do the full analysis on them, and we use them as a really hopefully valuable, and I think the feedback is always really positive on these, really valuable feedback tool to help you guys understand, because I'm talking about it in a fundamentally quite abstract way here on the live today. But hopefully it helps you guys anyway. And yeah, I'm gonna get on some questions because I can see TikTok is rolling in here. You don't need to come up. There we go, awesome. So Walks has said, please can you tell me about an annular tear? This is a healthy disc, right, for model purposes. You'll notice that the nucleus, which is this bit in the middle, is contained within a ring of many, you guys can see on there, you guys can see, might be able to see, put it in front of my face. You can see like there's these little lines that denote the layers of the disc. Those are all ligamentous layers. Those are the annulus. The way in which the disc works is that when we squash down on the disc, the fluid tries to escape, but because the annulus is intact, it holds that in place, it stretches a little bit, and it absorbs the shock. If you have a disc bulge, herniation, sequestration, insert other adjective here, you have torn in some way, shape, or form, damaged, degraded, fissured, whatever you want to say, you've got an injured annulus fibrosis. So all of you guys with herniated discs, etc., whether it's explicitly mentioned or otherwise, fundamentally, the annulus is the thing that fails. When you injure the disc, it is the annulus fibrosis that is damaged in some way, shape, or form. Now, whether that's an explicit mention of a tear of some description, but fundamentally those bits of stuff that's kind of leaking out or bulging out to the side, in most cases, that's a degree of annulus fibrosis. It might well be some nucleus pulposus that's come out into that. But that herniation that you see, this obviously would be an example of just the nucleus squirting out. But invariably, the annulus is going to kind of move a little bit to the side as well. So you're going to see that damage. But fundamentally, understand that disc injuries, disc herniations, disc bulges are annulus fibrosis injuries, really, at their root cause, one could say. You don't fix the nucleus, you fix the annulus. Now, Broken James has said, does chiropractic help a disc? Fundamentally, you have to know what you can do and what you can't do. So it depends on what kind of chiropractor you are seeing. The same it would be with regards to an osteopath, with regards to a physiotherapist. Now, if they're using some cool technology, like they're using the IDD tables or spinal decompression tables, if you're in the US, that might be the DRS or DRX 9000 decompression tables. Maybe they're using some laser. We had some comments yesterday on PRP injections. Those kind of interfaces are going to help with the healing of that particular injured disc. But if they're not using those kind of things, most of the mechanism for them to help you, the chiropractor, the physio, or the osteopath, is going to be getting other areas to work better, right? Because when you've injured your back, you're standing a little bit funny, you're leaning more on one side, there's stiffnesses here, there's stiffnesses there, etc., etc., etc. And so those stiffnesses often make the problem worse. So your hips aren't working very well because they're tight, because the signals come out of that area, go down to the hip muscles and they tighten them up. Your thoracic spine isn't moving so good, your neck's not moving so good. And the chiropractor, the osteopath, the physio, whoever, might well work on those other areas to help them work better, to lessen the burden on the section of the spine that is trying to recover. That's kind of the main way in which those professionals are going to be intervening, interfacing with you to help you get better. If they are saying they are healing the disc, that's a very big stretch, and you want to say, precisely what do you mean by that? Because no one really heals the disc. You heal the disc. You are the one that is healing your disc, and it's happening automatically. Just like you guys might see, my finger's healed a bit more today, right? A little cut on my finger, it's healing. Or as my daughter would say, it's healing off, right? It's healing off. And so you are the one that heals. And no more does a chiropractor heal your little finger where you've got the cut on it, do they heal your disc. They are helping your body go through the healing process, invariably by removing the barriers to that healing process that might well be present, either conscious or otherwise. Some comments on TikTok said, I have become so sensitive to sciatica and disc herniations that I would get very severe leg pain just from bird dogs and hip hinges. Storyteller, you must do the variation that does not aggravate you. I would suggest bird dogs are not really ideal. I would definitely check out the link in the profile page, or rather the link on the, I'll put it in the chat here. Go and watch the video there. But some of you guys, if you're struggling with this kind of stuff, like I know many of you guys, because we get so many comments on TikTok of you guys going through and using like the core 5 and that kind of stuff yourself and making really good progress. But some of you do need more help. And so check out the link in the profile page and the link that I've just posted down there on YouTube. Link up here for those of you guys on TikTok. Because like that gives you the structure of what you need to do, right? The important thing to understand here is everybody has pain at some point, and the job is it hurts. Precisely when. We need to be specific when we're talking about any symptoms that we get during our exercises. If you're doing the right kind of exercise, now I said bird dog's not ideal. Use a dead bug instead, right? There's a number of reasons for that. I can go into that if anyone questions me specifically. You need to find what you can do, not what you can't. What you can do without aggravation, not what you can't. And so we do an easier version. Oscar said, I'm struggling with the dead bug. Do an easier version. Lie on your back on the bed or on the floor and do the core engagement. Try that today. Oscar, try that today. Does that aggravate you an hour later? Okay, the core engagement didn't. Okay, now try the next step up, just lifting one leg. Did that? No, that didn't. Okay, well now I'm at a point. You'll find a point. And if I use the squat, for example, just to save me jumping up and down, if I can squat to here, that's okay. If I squat to here, now my back starts rounding, that's painful, right? So don't go that far. Do an easier version. You need to do the easier version that you can do, not necessarily aggravating ourselves. So the real work, Oscar, storyteller, find the hip hinge that you can do. What that you can do. I repeat, that you can do, not what you can't do. And then progress on from there. That's the most important starting point we really should have. We should spend a very short period. Oscar, no, do an easier version. That is the substitute, right? If you're lying on your back, you're saying you can't do a dead bug without getting aggravation. And admittedly, the aggravation here is a good while later, which I would be very dubious about. Like, just do the core engagement. Go back, Oscar, and watch the tutorials on this, right? Do the core engagement. Okay, what about that one, right? Okay? Like, you have to do that exploratory work. You have to go back and go through those to find what you can do. What you can do. Are we saying here that, for example, in Oscar's case, we can't lie back on the floor and just engage the core? Then we're doing something wrong in terms of the engagement movement, because I've seen you do the squat and the hip hinge, etc., at a certain level. So maybe we're doing some pelvic tilting, maybe we're doing some pelvic tucking inadvertently. Maybe we're actually straining rather than engaging. We need to explore those kind of things. And Oscar, I would really encourage you, go and do some of that hard work. Start at basic, right? Start at just doing the most simple version. Go back to the very first phase 1 tutorial for the dead bug. Do the simplest version this afternoon and report back. Say, Mike, I was lying on my bed and I did the core engagement for 10 reps and this happened, right? And then go from there. And then we can build up. Okay, now try the next version. Okay, now try the next version. Then we find a version that we can't do. And then we find where it failed, where we had the trouble. We have to do that work. Sometimes, because the other exercises are quite smooth and quite quick to find the troubleshooting point, we want everything to be like that. And this is where people often ask us, I need something tailored to me. I need the exercises tailored for me, right? I need the exercise tailored for me. It's like, yes, this is how we tailor them. All of these exercises demonstrate the ability to stabilize the spine and prevent it from moving in a given way, a given exercise, a given movement. And so your job is to learn how good at this you actually are and work diligently with those tutorial videos to find what you can do and the cusp of where you can't. And so which variation that is, I'm not sure. No one's sure. You're not sure. Your practitioner's not sure. The surgeon's not sure. We're only sure once we've tried it. So go back and dig into these things. The other thing to bear in mind, Oscar, as well, is if we're doing some other bits and pieces now in the gym as well, just make sure none of those are confounding variables for what we're doing. So I would suggest the best option would be perhaps try it later in the afternoon, evening. Try it one afternoon, evening. Say we're going to go to bed at 10 o'clock. I don't know what the time is for you specifically. Try it at like 8:30, 9 o'clock. Do that test that we've just discussed. And then please report back in the members area. Report back in the members area, because then we can do more back and forth than we can do on these lives. Awesome. Other questions that we've got coming in. Man, we've got a lot on TikTok. I'm going to go through these as much as possible, guys. I will catch up. As I said, I'll be here for another 40 minutes. So we've got time. Hang in there. And if you're finding this helpful, let us know in the comments, guys. We've been trying to do these to help you guys, and hopefully it is really helping. Donald Duck has said, is it a good idea to do the hip hinge and the squat on different days? Thanks. Yes, we typically suggest that when you are starting them out in phase 1 of the program, Donald, that you are doing them in one routine, right? Once you've learned them, you do them in one routine as per the strategy material that we talk about in the program. But once you've done that, as you move into phase 2, we start splitting them out into different workouts on different days. Oscar said, so should I do it on the resting day? Oscar, I'd just do it this afternoon. Do it this afternoon. If everything's feeling normal, okay today, do it this afternoon. As I said, sometime in the evening, providing you're feeling all good, feeling all okay. So it's a fair test. What else have we got here? Storyteller, I'm in pain after I did the hip hinge last night. What should I do today? It depends on when you precisely were feeling the pain of the hip hinge, right? Did you feel it during the hip hinge? If so, we need to do a bit more exploration work. Understand that if you're doing a careful hip hinge, right, you're doing this, and you've done 10 reps of this, there are like 101 things that you're going to do for the rest of the day that are going to be significantly more problematic. Quite frankly, probably brushing your teeth in the evening is going to be more problematic than a careful hip hinge like this. Now, if you weren't being careful when we're doing the hip hinges, that's a problem, right? That is a problem. But chances are you're doing this. So bending over to brush your teeth, that's going to be more strenuous. Getting undressed, that's going to be more strenuous. So when we are in the early days of this recovery process, please bear in mind, guys, that most of what you're doing is going to be more strenuous than the individual exercises. So it's like, what should I do today? Did you get dressed this morning? Yes. Have you been to the bathroom already? Yes. Have you got out of bed this morning? Yes. Okay, all of those things are more vulnerable, more provoking than a careful application, recording yourself doing the hip hinges. And so we want to look at that. We want to look at that. Definitely have a dig into what we're doing and making sure that we're recording ourselves when we're doing these things. And this is one of the examples as to why, Storyteller, I don't know if you're in the membership, but if you are, get in there and upload a video of you doing this kind of stuff so we can see and give you more guidance. But again, after 30 minutes, the real question is, what did we do for the 30 minutes afterwards, right? When we often have these things, right? We're like, okay, so I do my squat, I do my hip hinges, I do my 10 reps, right? I do 10 reps of a squat, careful squat, no aggravation, great. Then we go and sit in front of the TV for the next 20 minutes afterwards like this. And it's like, oh, now I've got pain. It was the squats. It's like, no, it wasn't the squats. It was the fact that you were sat like this, chilling out. The doorbell rang, you jumped out of the chair to go and get it. That's the problem, not the squats that we did earlier on, the 10 of them, with really real care and attention. And that's what stops so many people, because when you are early on in the recovery process, everything you're doing every day is the problem, in most cases. Lewis has said, how can I train flexion with an L5-S1 disc bulge? Don't. Leave it out. Leave it out. Oh, you've got a year, that's plenty of time. You can make some good progress there. Leave out the flexion. Focus on doing neutral spine, building load tolerance to a significant level, especially if we're going to be getting in the military. We talk about 3 numbers. I'm slightly modifying the first 2. Think about 20% of your body weight, think about 45% of your body weight, and think about 100% of your body weight, specifically Lewis, but all the guys, right? 100%. Ladies, 75%. And then get your squat and or hip hinge to that level, able to do 5 sets of 10 reps without any trouble, without any aggravation or anything like that. You will start to notice that you can start to bend forwards again. You'll start to notice that you become less flexion intolerant. Now, flexion with load, that's going to be a problem, right? But focus on building neutral spine load tolerance. It's much more predictable. Sure, you could do it doing Jefferson curls. You can do it. I know there are people that do it. I don't think that's a smart move at all. I think there are so many people that really struggle with that, and it's misguided. Go through the path of lowest probability of failure, least complexity. That is the way forwards. It helps you make, there's so many variables that are there every single day in what you do that detract from your understanding of how you're responding to things. And so having unnecessary complexities like trying to introduce flexion, it's not helpful. What else have we got here? Comments. I'm going to try and jump forward to some of these comments here. My calf and feet has more burning sensation. Sciatica, L4-5 herniation. What to do? going for a right L5S1 microdiscectomy surgery. Any tips for recovery? Do one more. What do you think about using hyperextension bench to help alleviate a herniated disc? So you guys are all struggling with injuries at the same level of the lumbar spine. Cameron's having a microdiscectomy. Trinity, you've got symptoms down into the leg with an L4-5 issue. What we need to do is the same stuff, right? Whether we've got a microdiscectomy surgery next week, this afternoon, whatever it may be. One of the really important things if you've got the surgery booked is try your best to make some learning before you have the surgery. Because if you can learn those things before you have the surgery, then the mistakes process is done before you have the surgery rather than afterwards. Everyone makes mistakes when they are doing the rehab exercises, if they are sincerely trying the exercises. Do you know why that's so important that you do? Because if you can already do it, you will not get any benefit from it. I repeat, you only get benefit if you find what you cannot do and then progress and learn so that you can do it, right? That's where rehab comes in. If you come into the clinic and we go do 10 squats and you do 10 squats and then you keep doing 10 squats for the next 6 months, you will not make any progress. That's not how progress is made. Progress is made by going, I can't pick up my toddler because they weigh 12 kilos. So we start with the squats with body weight and then we build that up and build that up and build it up. And then we get to doing the 25, 30, 40, 50 kilos. That is how progress is made. And therefore, when people start out, we talk about the core phase 1 level of the program, learning these exercises like we were discussing with Oscar with the dead bug, others with the hip hinge, etc. You're learning how to perform these, which inevitably involves you making a mistake at some point. And so if we're using tutorial videos, if we're recording ourselves, if we're making notes as we go along, then we will have the most probability of success and we will learn from those errors. And it's great if we learn from those errors before we have the surgery rather than making those errors after the surgery. Now, I'd also have a serious conversation, Cameron, making some notes perhaps ahead of time for the surgeon, saying things like, hey doc, when can I do a squat again? This is the best question, right? When can I start doing squats again for my recovery? And he will say, don't do those for like 6 weeks or something to that effect, I suspect will be the knee-jerk reaction. And then what you need to do, Cameron, is you need to sit on your hospital bed and not get out of the chair. And then when the nurses come around and say, hey, you can go now, you say, no, I can't. I said, the doc said I can't squat, so I can't get out of this chair. Then he'll come back and you can have a more productive conversation, right? Because the reality is, after your surgery, you're going to go to the bathroom, check everything's working, all that kind of stuff. You're going to get out, you're going to go home, right? That's going to involve you getting into a car and then getting into bed and getting out of bed and getting dressed and going to the bathroom and all these things every day. So the notion that you shouldn't practice carefully doing a squat to control your spine and realizing that actually I can only control it to here, but my toilet seat is all the way down there, so how am I getting down there? Oh, well, I just kind of go like that. Oh, well, that's not ideal, is it? You can see how that's not ideal, right? So learning these things beforehand will increase the probability that you have a more favorable recovery. It's always better to get the mistakes out of the way beforehand. Very important, very important. Some more comments coming in on, man, you guys are really throwing a lot of comments in today. Hopefully this is helpful for you. Thank you for all of them. I really appreciate it, guys. I wouldn't bother doing these lives if it wasn't getting comments, right? So I'll go through them, as many of them as I absolutely can. But I appreciate them all. So Lewis has said, thank you for your help. I didn't quite understand what you meant. Can you explain it again more clearly? If I don't train flexion, when I'm put in crushing positions, I will flare up again. Yes, but it's what you do first, right? A child doesn't learn to run first. They learn to crawl, and then they learn to get up to standing, and then they learn to walk. It's not saying, Lewis, don't start introducing and training flexion, but it's all about timings. If you currently cannot squat your body weight holding onto a 5 kilo weight, there's no point doing flexion work because flexion exerts a significantly greater amount of strain that is very difficult for you to predict. You can't predict how strain changes as you go through the ranges of motion, right? And what's probably going to happen is, like it's happening to this joint, that injured segment is the one that's going to move most, and therefore strain is going to be placed through that one in a way that you can't predict. It's functionally very difficult. Imagine you went into the gym each time to do bench press and you were blindfolded with regards to what the weights were put on and someone else just whacked them on who had no prior context of your previous session. You'd get into a lot of trouble. And the problem with flexion is you don't know when you do your Jefferson curl how much flexion is actually going through the lumbar spine today. And it's very difficult to standardize that. So if you start by building up standardized and very repeatable movements, such as the squat with a neutral spine, the hip hinge with a neutral spine, you can steadily build a good degree of load tolerance in the neutral in a way that gathers momentum. And one of the most important things we can try and shoot for is that we are making more and more progress in the objective strength of our spine between flare-ups. Flare-ups happen to everybody, but you want to prolong that because it's like picking the scab. If we can let more healing take place between these flare-ups by using a more safe and reliable strategy, such as the neutral spine loading, we're still strengthening all those same structures, but we're waiting to put them under more unpredictable loads, such as that in flexion, right? It's just about having strategy. Yes, you know, I've talked about this before. For me, as doing jiu-jitsu, there is every chance that I'm in this funny position like that, and someone jumps on my back and pulls me down like that. And that puts a hell of a lot of load through my lumbar spine, especially if that person is of similar weight. So would it be reasonable for me to train in that range of motion? Yes. But I don't train in that motion when I can barely pick up a 3-kilo kettlebell. I train in that range of motion once I've built good objective loading in a neutral position. In my opinion, it's just a safer way to go about things. It makes more sense. And then you can build in your specific areas of load tolerance. Hopefully that makes sense. Oscar said 100% of body weight for men. Yes. So whatever you weigh, your target for your squats and hip hinges, long term, this is long term, Oscar, not next Thursday afternoon, right? Long term, you want to shoot for around about 100%. So for me, 90 kilos, 92, 93, I'd probably just round up to 100 for safe numbers, easy numbers. 10 reps of 100 kilos on the squat or hip hinge without getting back pain, aggravation, etc. Chow Depra has said, could I send you my MRIs? We get many of the members uploading their MRIs and things like that to the members area. So if you want any help with those kind of things, I would strongly suggest check out the link. I've put it in the chat, but I'll just post it in here again. And guys, those of you on TikTok, if you need more help and support, I'm trying to get through as many of the questions as I can. If you do need more help and support and you've been struggling with your back pain and your sciatica, definitely check out the link in the profile page and sign up to the program. There's a video there that explains a little bit more before you join. If you like what you see, you can get involved and get some help and support. Looking on here. What else have we got here? I think I might have psoriatic arthritis. I have an appointment with MSK. Is there anything I should ask them or to watch out for? It took 2 years to get the appointment. Not really that I can think of off the top of my head. Starshine, just make sure you're making some progress on the rehab front, building load tolerance. And if you're struggling with anything specifically, definitely reach out to us. If you're struggling with making some progress past 7 kilos on the squat or 15, 20 kilos on the squat, let us know. What else have we got here? Just going through some comments on TikTok. My sciatic pain is gone, barely there, but my foot is still numb and heavy. Can I still reverse it? I think we're probably talking about some element of nerve damage there. I'm not sure what you're doing, Sherry, from a rehab point of view. I'm afraid, so I can't necessarily say anything with too much confidence, if that makes sense. Tommy said getting referred pain one day in the bottom. I can't quite grasp that one. I have a herniated disc, can walk but struggle to sit. Working in a call center, how can I overcome it? That's really tough because you're having to sit every day. It is going to be difficult. Alice, the best thing we can do is set our workstation up as best as possible. So we can use like sit-stand desks if possible. Having a perching stool can be helpful. Trying to use a little, so we're in this sort of position. Try and position it so your thighs go away from you rather than like that, because you can see what that immediately does to my lower back when I'm in this position, right? That's going to be helpful. Try and take regular breaks as best you can. If you can stand up, that would be ideal. If not, it's difficult, right? But the most important thing is that we work on building our spine back up again. That you're doing your rehabilitation work to build spine resilience. And what you notice is whether it's walking, whether it's driving, whether it's sitting in the call center, working, those things get more and more endurable as you build objective strength in your spine. It's just that simple. It's just that simple. Unfortunately, as simple as it is, it takes time for that to take effect. It just takes time. I'm going back onto YouTube. Hi, Mike. I've been absolutely disciplined with the back in shape for the past 4 weeks, now in phase 3. Nice work, Brad. I sometimes feel the need to stretch my stiff, newly hardened back. What do you recommend? The best scenario here, Brad, while you're going through this kind of transitional period, getting into some of the quote-unquote more hard workouts, is definitely leaning on things like the massage gun, right? Because you might well be getting a little bit of DOMS in those lower back muscles from the hip hinges, right? A little bit of stiffness in the hamstrings, might be pulling on the lower back. Again, a normal consequence of the hip hinges. So managing the stiffness that is a normal part and parcel of getting into the workout, knowing that very soon you'll find that you miss the DOMs, right? You miss that stiffness that comes after a workout that tells you you've done it right. For the first time yesterday since the knee injury, I started doing squatting again, managed to do 10 reps of 90 kilos, which I didn't think I had in the locker, and my legs are feeling pretty sore today, right? That's going to be affecting my hip mobility. That's affecting me moving around. That's going to have a knock-on effect on the lower back. Leveraging things like the massage gun right now. Maybe, Brad, check out the longer version of the core relief routine. I think it's around about 15 minutes, includes some more stretching of the lower body. That can help as well. And just work through this. Try and avoid, if you're feeling like you need to stretch the back, towel decompression. The bed decompression as well as strategies. Getting a bit of that massage gun just in there, that can really, really help. Just make it feel nice and relieved as a result. And just keep tabs on that as you progress on. Make sure as well you're starting to look forward to the phase 4 material as well, just to make sure we're factoring in some rest days, right? Rest and recovery days where we're just doing core relief work, because we don't want to end up overtraining as we start to ramp up the intensity here. Very important. Lewis has said, wouldn't waiting to get lifting body weight on squats and deadlift without training flexion make me weaker? In those positions, no, it wouldn't. It wouldn't, because you're challenging the same tissues, the exact same tissues, when you are doing those movements. Lewis, you're challenging exactly the same structures. You're challenging the segmental stabilizers. You're just not putting them in that funny position. So there's plenty of time to get into that. You've got to pick somewhere. You can't do everything at the same time, and you want something that is scalable. If you do that, you'll build back tolerance, right? Okay. Example. 36 kilo kettlebell, 80 pounds. I don't train that. And I've done that demonstration many times before. Right? I don't bother training flexion. Do you know why? Because I have a busy life. You've got kids to look after. I've got the business to do, looking after all you guys and all the members, right, in the program. Hobbies, interests. I don't have the time to spend 16 hours a day in the gym. Yes, some of the guys on social media give you basically a list, like, a 14-hour warm-up followed by a 1-hour workout and then a 17-minute, cool down. Like, most people don't have that time. You don't need to do that. If you do have the time, awesome, right? You can add in some extra stuff when you get to the appropriate level. But most people in the early stages of recovery, you need little bits that you really master, and you can add that other stuff in later on. If you build good health and strength into the spine, just because you're not training every single range of motion doesn't mean it degrades. You're still putting those same tissues under tension when you're going through your compounds. That's one of the most important principles of the program, is that by having those compound movements in there, we're working so many things in a very, very time efficient manner as well, that reflects the reality that most people are not, for example, students at university doing lectures for like 3 or 4 hours, a day, or if that, in the first year of university, where they can spend. Like, I remember when I was at university, and it was an awful lot more busy than that, because those kind of degrees are. But like, I was able to go to the gym so much more than I am nowadays. And so, yeah, you can do all that fun stuff, but you don't need to. You don't need to. We think sometimes more is more, and sometimes actually less is more. Something to think about anyway. Magdalena said, Mike, I have an L4-5 and L5S1 bulging disc. Herniation, annular fissures. Is there a way to sit down without pain? Yes, Magdalena, you need to build load tolerance. You need to build up strength and stability in your back, because when you sit down, you put more load on the spine. And so if you build up strength and resilience to that, you're going to find it is more tolerant to that excess load. Sunshine said, you keep talking about neutral spine. I have a severe lordosis along with bulging discs and spondylolisthesis. Is a pelvic tuck still not recommended? Sunshine, you need to have measured your lordosis. A severe lordosis isn't actually something you would say. That doesn't make sense. You might have an increased lordosis, in which case you need to know specifically how much. We just started. Sunshine, you're on YouTube, so you can go back and watch the start of the live stream. Go back and watch the start of the live stream. And then come back and throw a question in, because we literally were speaking about that specific concept. Very important. Very important, because so often we get told that we have these increasing curves. That's not to say people do, but it should be measured on a standing image, especially if you've got something like a spondylolisthesis. We need to know. That's important. The other thing as well is with regards to a pelvic tuck, how do you know you're not pelvic tucking too far, right? You don't. You don't is the answer, and unfortunately, so many people, make that mistake, and then it ends up making things worse. What else have we got in here? Kayan has said, what do you think about using a hyperextension bench to help alleviate herniated disc? I think, again, we're focusing on the wrong sort of things. I would focus on a neutral spine. Hyperextension, I don't think that's, hyper anything. If you've got a back injury, hyper anything I think is bad, right? Hyper anything. It just sounds too aggressive. Focus on the neutral spine, building load tolerance in the neutral position. It's the safest and most reliable way for you to build load tolerance. And then you can test some of these things. If you really have a proclivity to want to do those things, you can go ahead and do that. But build good load tolerance first. Like, for example, we had a comment on kettlebell swings the other day. Kettlebell swings are a really cool exercise, right? They're really cool. Okay, they're a hip hinge with a little bit of modification in there and great for cardio, strength, practicing movement, etc. But if you're, like, what people do is they do a deadlift or a hip hinge on like 15 kilos, and then they pick up a 15 kilo kettlebell and start kettlebell swinging it. And it's like, what are you doing? You build good strength in the static and then move over to some of those dynamic activities. Feed them in at the right time rather than trying to do everything at once. Build foundations and then you can start having more fun. Build the foundation though first. My chiropractor suggested res laser for my disc bulge. Magdalena, we use class 4 laser in the clinic. When I tore my knee cartilages back in June, before the competition, that week of the competition, I was on that laser like 3 times a day, literally. And thankfully, I did the competition. Got a knee strap, got a knee support, did a ton of laser. It works for tissue healing. It is really, really good. But it is not the only thing you're doing. That is an example of doing something to help with tissue healing explicitly. And having significant experience in that, being a primary modality that I've used over the last, maybe close 8 to 9 years, because I wasn't using it straight away. Originally, I was doing a lot of manipulation work, clicks and pops, right? In a high volume chiropractic clinic with all the x-rays and all that kind of stuff that I mentioned many times before. But laser, I've been using it probably, I'd say pretty much 10 years, give or take a year, I'd say. It's good, it works, it helps. And I've seen that predominantly the experience has been with the lower back specifically. And we use a K laser as the brand, right? There's a lot of cheap rubbish lasers that don't do anything. They're not actually lasers, they're just low-level light therapy, which is very important that you distinguish between the two. But with the K laser, so much experience with it for the back specifically. And then obviously, anecdotally, my knee, amazing. You know, like I said, I just did squats, 10 reps on 90 kilos, and I'm still jumping up and down, you know, after getting a reasonably significant tear to both the medial and lateral meniscus back in June. And then competing the week later, you know. It's not magic, but it does really help. And then my brother with both of his pec tendon tears from being silly. So good experience with that, and they do work. They are really helpful. Oscar has said, which exercises is better between low squat and barbell squat? I think that for most people, a low hold kettlebell or dumbbell squat should really be done. So like the kettlebell squat, so squatting down like so, right? You should really be doing that up to a pretty good level. Like that's a 36 kilo, maybe you go 36, 40 kilos, something like that before you switch over to a barbell squat. And I'd be doing a back squat personally. I prefer that. Because the barbell is going to weigh 20 kilos and it's a new technique, a new balance, etc. And so we want to make sure that we have room for error. So if I go from doing 36 to 40 kilos on my kettlebell or dumbbell squat, which has a slightly different center of mass, a little bit safer, I would add. And then I switch over to the barbell because I'm going to need to use the barbell to scale the load higher. Going over to a 20 kilo barbell would be a nice bet because the weight's light enough for me to feel comfortable with it, and then I can play around with the technique. So that's what I'd say there, Oscar. Coming back over to TikTok, I'm gonna have a drink and have a look at some of these. Oh, thanks, Brad. I just got a notification of a super chat, so I appreciate that. That's kind. Oh, thanks. So Brad said here, Back in Shape is the best program out there. I am deeply grateful that you have pulled me out of my endless cycles of pain. That's really nice, Brad. Thank you. I really, really appreciate that. Thank you. Well, I mean, we haven't. We've done it together, right? You're the one that's done the work. You know, you've worked with the tutorials, you've asked the questions, you've done the hard work. You know, as I say, no one fixes your back pain for you. It is a collaborative effort between you and whoever you're working with, right? That's the most important thing to understand. Too often people go around with their back pain in their box, their sciatica in their box, as bad as it is. Can you help? Can you do it for me? You do it? No, that's not how it works. You have to do the doing. You have to do the doing. So important. Magdalena said, the program mentioned everyone starts in phase 1. Yes, How do I know when I'm ready to move to phase 2? The way in which we structure the program, although it seems like there's a lot of material in there, and there is a lot, right? There's hundreds of videos there. There's troubleshooting videos, etc. We structure it into a strategy section. Each phase, and everybody starts at phase 1, everybody, no matter how good you are, no matter how much experience you have, everyone starts in phase 1, and there's a strategy section, which normally is about 7, 8, 9 videos, short videos that instruct you on how to go about the phase. And towards the end, how do I know when I move into phase 1? Oh, sorry, into phase 2? It's all laid out structurally for you. And of course, we have the members area to support you guys as you go through the process. That's the point. It's structured. There are strategies, and then there's educational material, there's practical material as well, obviously, as you'd expect, you know. So that's how we structure it. Very, very clear once you get in there, right? Just using that strategy material to guide you. The strategy is like your instructions. This is how I do phase 1. This is when I move on to phase 2. This is how I do the exercise. This is how I use the tutorial videos. This is how I use the live workouts. This is how I integrate the core relief work. And then the core relief work has its own strategy section. So it's very, very natural. You don't need to worry about the phase 4 strategy stuff. You don't need to worry about any of the phase 3 videos. You don't need to worry about any of the phase 2 videos until you get there. So you focus on your bit, right? And then you move on. And we're there to help you, as I said. I'm not going to try your name, Zala, because I don't want to butcher it too badly. Which is the best exercise when we would join the gym after a disc herniation? Here's the kicker, right? If you're doing your rehab properly, your rehab turns into your gym workout. So you just do the same stuff you're already doing. You just do it and you utilize the gym equipment, right? You might start off, your squats might be holding onto an overly sized water bottle like this, right? And then they progress onto a dumbbell, and then they progress onto a kettlebell. And then you use the gym equipment, the barbell in the gym. You could also start off in the gym. So the whole point of your rehab is that it should just evolve into something that you can do at the gym, or you can keep doing at home. So please bear that in mind, guys. That's the idea. That's really helpful. Because otherwise, then you have to, as soon as you go into the gym, you have to start a whole new process of learning things again. And learning, as we discussed earlier, is the point at which mistakes get made. Raphael said, what are the benefits of going to a chiropractor when having an L5-S1 disc bulge? Is it overrated? I don't think it's overrated or underrated in any particular way. I think you have to understand what they are there to do, how they are helping you, what technologies they have, and if they have any, or if they're choosing hands-on work, and how they think they're helping you. That's the most important thing. If they are a purely manual-based chiropractor, meaning they're doing the clicks and pops and moving and twisting the neck and all that kind of stuff, they're understanding, in my opinion, having worked, as I mentioned earlier on, very closely with chiropractors through the early part of my career, the understanding should be that they are helping get other areas of your back working, your hips, your knees, your ankles, so that that L5-S1 disc bulge has the best chance of it working. If that L5-S1 disc bulge is struggling there and your hips are stiff and your back's stiff and your neck's stiff, how does the neck relate to my lower back, Mike? Well, every day when you pull out of your driveway and you're sat in your car and you turn your neck, if your neck's super stiff, you have to twist round on your lower back. Not good for the disc that's herniated. So if your neck and your thoracic spine can get more mobility through them, then your lower back has to get strained less. It's a very simple but good example. And that's what they can do. Now the question for you, Raphael, is how much do you value that versus how much you value the money that you're going to have to part with to have that appointment? And that's a value judgment that everybody has. Everybody has different means. And for some people, it's actually the time. I don't have the time to go there. It's inconvenient for my time to get there. For other people, it causes me too much discomfort right now to go. One of the things that we've really changed the way in which we approach about these things is that we really insist that anyone that wants to come in for treatment starts the program first. They don't come in for treatment first. They start the program first. That's the most important thing. Magdalena said, doing 5 core exercises and the back relief routine the past 6 weeks, I think I should progress. Yes, you should. Yes, you should. If you need help with how to progress, then that's where the program comes in. Starshiner said, I fell off the program for some personal reasons, probably 6 months now. But over the years, I've learned the techniques and movement. Should I go back to phase 2? Starshiner, the program has changed a little bit. And understand, these things happen to everybody. We get members that come into the program, they dip in, they dip out as they go along. We're there whenever you guys need us. And so I would probably suggest the best thing to do would be come back in and have a look at the upgraded program. It has been through some significant changes since you've been with us. It was 6 months ago, right? Have a look through that and get started, I would suggest, on phase 1. And then you can stay with us as long as you need, guys. You can stay with us as long as you need. The program is there to help people. We don't believe in any long-term contracts or any of that kind of stuff. You have a subscription, you either pay every 4 weeks or you pay every month if you want, every year, sorry, if you want a discount. And you can keep the subscription running as long as you want or cancel it as often as you want and come back and dip in and dip out. It's there to help you guys. And that's the most important thing. It's super easy. Just get involved, use it for as long as you need it. Like, and we're happy to have you as part of the community again. And to anyone new here that's here, like, we're happy to help you guys as long or as little time as you need. Everyone has different needs, right? And so you just use us for as long as you need. That's the most important thing. And we'll be happy to have you for however long or short that is. We've got an user 653 who said, I got a herniated disc about 3 months ago and I'm a marathoner. Should I be running? Will it heal? I would suggest you focus on your rehab work. I do think that, and my views on this have changed after looking at some research, and this was a number of years ago that I had this change in view. And actually I think that if you are a long-term runner, if you're going to be running for years and decades to come, I think getting back into running is a good thing to do. The most important thing is that your running volume is very, very slow to change, but focus on the rehab work first. Focus on strengthening your back first. Focus on building back tolerance in the lumbar spine first, and then start to approach the running. And a pro tip for those of you guys that want to get back into running, understand very clearly that when you are getting back into running after not doing it, it is better to do it on the treadmill. And I know some people will hate that, but the reality is, if you're running around the block, and maybe if you've got an outdoor track, then that's a little bit different, right? But most people perhaps don't. They're running around their town or area or whatever it may be. You've all been in those scenarios where you're running along, car pulls out, boom, you have to stop suddenly. That's nothing to do with running. That's just that you had to suddenly stop. And now all of a sudden your back has flared up again and you're unhappy about it. On the treadmill does that thing that I mentioned earlier, is that it creates a controlled environment for you to do short duration runs, set some reps of those and build those up over a period of time to minimize the likelihood of something going wrong. Something going wrong that's nothing to do with running that sets you back. And so that's the best strategy and route in, and we talk about that in more detail. Starshine has said, I'm still a member. Starshine, get back in and use the material. Go back through phase 1, core phase 1 it's now called, right? You'll still have access to the legacy material. Core phase 1, 2, and get started on that material. Spend maybe the afternoon, a couple of days digesting it, just revisiting the new tutorials and all that kind of stuff, and then get into the members area, give us a little update, what you're struggling with, where you're at, specifically with the exercises, and then we can go from there. And guys, personal things happen for everybody, right? We have all sorts of challenges that come in the way of us, and we just have to do our best. Don't persecute yourself if you have things come up. Maybe a family member's not well. Maybe you have a fall and you fell over completely unrelated, and now your rib hurts or your arm hurts or your shoulder hurts or something like that. It's getting in the way of your rehab. These things happen, right? So don't persecute yourself for not being able to do it. Just get back on the horse and do what you can. Magdalena said, does the disc bulge go back to a natural place where it's meant to be or not really? And it really depends. The annular damage side of things, that is going to be healing. That is what is healing. That is literally the tissue that is going through this healing process. Invariably, it lays down scar tissue, and then over time, it's going to try and remodel that scar tissue, and it will have greater or lesser degrees of success in there. On TikTok, we've said, do sleeping positions matter? Not really. I think people worry about the time that they are unconscious way too much while they are doing all sorts of errors or making all sorts of errors on their conscious time. Try and sleep in a position that has a relatively neutral spine. Don't curl up into a ball, but beyond that, focus more on, on what you're doing in the day. Focus on what we're doing in the day. People get too caught up in these little things, right? If we just take the principle of a neutral spine, things like how to sit on the toilet, do the best you can. Do the best you can. Try and keep a neutral position as best you can. But you're probably not going to be able to, because that's not really possible. That's not how that thing works, right? You do your best you can, and you acknowledge that there are many things every day that are going to be setting you off. There are many things every day that are problematic. But as you build load tolerance, as is demonstrated through the progress you have made on your exercises and the fact that you're using more load than you were 6 weeks ago, you will find those things less aggravating. You will be able to get away with more. Now, some people go the wrong way at that point, right? They start getting away with more, so they try and get away with even more. Others incorporate those practices of discipline to the way in which they move and go on to have significantly greater success. So don't try and cheat, is what I'm saying. AJ has said, we're doing another MRI in a year to see if the disc has been reabsorbed back in. I think really a year to 18 months, like that would be reasonable if you want to spend that money. I'd probably suggest wrapping it up with one of, I've been looking into recently those whole body MRIs where you can, do it. They're quite popular at the moment. And I've been speaking to Vista about arranging for these. And I'd probably say it'd be more useful to wait 12 to close to 18 months and have demonstration through your rehabilitative exercises. That's probably the greater indicator. AJ, I've gone from my squat or hip hinge being 0 to now I'm doing, once I've hit that target, that would probably be the best point to consider doing an MRI. You've got that 100% body weight, 10 reps, no trouble, right? You've built good resilience. That's going to take you some time. And then, yeah, I would actually consider, rather than doing a specific lumbar MRI, because that's like 400 pounds, I'd probably be more inclined to look at one of those whole body MRIs and wrap it up in a health check, right? Yes, it's more expensive. Instead of spending 400 pounds, it's going to be about 1,800 to 2,000 pounds. Obviously, there's different means, right? If you can't afford that, then that's obviously a factor. But some of you guys can, and some of you guys can't. And for some of you guys, that's a lot of money. For some of you guys, it's not as much, right? But those of you that can, I'd consider that would be more valuable because it also looks at like the brain, heart, lungs, organs, pancreas, liver, etc., and the spine at the same time. So you kind of get a health checkup and a little evaluation point. That's something I'm thinking about more and more. Because I think it's a reasonable expense to go to just to validate what's going on there, and in a lot of cases, it's not, depending on the severity, it's not going to look like a nice white disc again, right? Nor does it need to, and that's the important point. And I'm happy to explore that concept a little bit more if you guys have particular questions. Do you recommend breaststroke with an L4-5S1 spondylolisthesis? No. Why? Like, we have to think about these things, guys. This is why we talk about education being so important, right? When you are doing breaststroke. Now, I used to swim with a guy that I believe he actually was training partners with Adam Peaty at some point in his career. He was very, very good at swimming. When we were swimming as teenagers, he was very good. He was a breaststroker. Even him, the spine is extended, right? So basically everybody else doing granny breaststroke, not to be disparaging in any way, shape or form, is going to look something like that. Not good if you've got a spondylolisthesis. I would argue it's just not helpful. The utility of having of getting in the pool is that you're in a lower gravity environment. That's the utility, right? So just wander around in chest-high water and have a chat with a friend, and then go home and carry on with your rehab work. That's going to be the best thing that you can do with the pool. Pool work is not rehab. Pool work is relief work. We make the distinction between relief work and rehab very clear. Rehab is stuff that gets you better. That is your exercise like the core 5. Those of you who need help with this, check out the link up here in the profile page. If you're on TikTok, I've posted it in the chat, but I'll do so again on YouTube. That is the stuff that gets you better. That's the stuff that literally changes your body. Then you've got relief work. Relief work is the stuff that you do, such as the towel decompression, such as the bed decompression, contrast bathing, using the massage guns, the lower body stretching, the core relief work for those of you that are in the program, right? That swimming would come into that category, or being in a pool, being in a lower gravity environment. Going for a short aggravation-free walk would come into that category. Those are the things that you do that do not have any cumulative benefit, but they're worthwhile doing if they feel nice, and if they don't hurt you, and if they don't make things worse. What else have we got here? Trinity, I think you're focusing on the wrong things, right? Trinity, focus on the rehab work, focus on the strengthening work, right? If you're going neutral spine, that's the thing that you need to think about, right? It's like what we're saying here is, I've got a broken leg on my right leg. How do I hop on my right leg without causing pain? It's difficult, right? You've got to do your best you can. Neutral spine is the way you think about it. That's the best thing, but focus more on the rehab work. You guys make the mistake of focusing on the symptoms, focusing on the fact that I can't sleep, focus on the fact that I can't sit, focus on how do I get down off the floor. Sorry, there's probably not a good way for you to get on the floor, because if you don't have the capability of doing a squat like that, more than that, without a neutral spine, you can't get on the floor. You just can't, right? You got to use something to support you. You come down slowly, and then you have to do the best you can, and that's what. But that's why we talk about principles. Just focus on a neutral spine. Focus on a neutral spine. That's the best you can do, and make sure you're building strength and resilience through your rehab. The rehab is what we need to focus on. Oscar said, "Is walking okay?" Yes, Oscar. Walking is relief-based work. Walking is relief-based work, as in the chat that I just went through. Guys, we are getting towards the end here. Magdalena said, is it the same when I sit down? I want to stand up and I hear a click. When I'm moving around or when I do stretches and exercises on the floor, I can often hear crunching in my lower back. One of the things to test when you have these sorts of sensations is do what's called a hyper-engagement. So do a hyper-engagement in the midsection and then do whatever you're doing, right? So it's super tight, so you can't bend the back, right? It's really tight and engaged. What you'll normally find is that those clicks and crunches go away, and that is the instability. Generally speaking, those clicks and pops, those are spontaneous cavitations from movement and the facet joints opening out and decompressing and get pop, like when you go to the chiropractor. Spice latte, why do I have heel pain with a disc bulge? Because that might be the referral pattern of the specific part of the nerve that's been irritated in you. One of the things that you guys will hopefully get from being on these lives, and I appreciate all of you guys joining and asking questions as we get towards the end, is that you realize that so many of you guys have the same sort of issue, L5S1, L45, and lots of you have different kinds of symptoms. You struggle with different kind of things. The secret to you getting better is in getting rid of those things from your focus. They are interesting. Your focus should be on the rehab because you guys all have the same fundamental problems. Danny has said thoughts on BPC 157. That sounds quite interesting. It's one of these peptides. It seems to be associated with tissue healing. From my limited understanding, it's about helping your body heal better. That to me sounds good. I would look into it in more detail. It sounds interesting for sure. I'm dubious about some of this stuff because I've heard it is an injectable, and I've seen more and more companies coming out with oral forms, pill forms, and I'm very skeptical about the pill forms, to be completely honest, as to whether they're just a waste of money, people jumping on the bandwagon. So that's my kind of 2 cents worth, Danny. I think a lot of the bodybuilding communities talk a lot more about things like BPC 157 and TB 500. I really can't stand needles. So it's just not one of those things that I've looked into as much because it makes me feel a bit queasy. Oscar said, like, for how many minutes? We really suggest that, again, walking is not getting you better, Oscar. Walking is something that you can do, right? You do it for as long as it's aggravation-free. That's the most important thing, right? And yeah, that's pretty much it with walking, just thinking of where you are in the recovery process, Oscar. There's no set minutes amount, aggravation-free, but once you get past about 20 minutes worth of walking, we have to ask the question, are we walking for the sake of walking? Because that's pretty much it. There's no point doing longer than that. We start getting to the point where we're just wasting time. Now, if you've got lots of free time, then fair enough, that's fine. And if it doesn't aggravate you, then fair enough, that's fine. But have a real think about that. What else have we got here? Becky, how do you get into exercise and lose weight with SPD? SPD? Please, my mind's going blank on the abbreviation, if you wouldn't mind. Can you recommend any foot drop exercises? Generally speaking, if your foot drop is associated with your lower back injury, focus on the lower back injury. Invariably, if we've had a nerve compression or irritation to the point where it's damaged and resulted in the foot drop first, we need to actually work on the rehab side of things for the lower back to stop the problem, the cause of the problem, and then slowly those nerves are going to heal, but the nerves heal super slow. A lot of what you're doing in your normal rehab work will actually be strengthening things up anyway, and you're going to be affecting the muscles that dorsiflex the foot. And yeah, sure, you could add in some extra dorsiflexion work, but I'd focus on just the essential rehab, make significant progress there, and then you can add in some more targeted work in that domain. And to the degree the nerve is going to heal, depending on where exactly that nerve damage is, you should notice improvement, but it's going to be slow. The foot drop side of things is going to be slow from an improvement point of view, and might be limited in terms of the prognosis, how far you can actually improve it. Guys, I'm going to wrap it up here. For those of you guys on TikTok, guys, hopefully it's been really, really helpful for you. Guys, again, if you need more help with your back pain, if you've been struggling for a long period of time, if you've got L5S1, L45 injuries, you've got sciatica, back pain going down the leg, coming from here, check out the link, those of you on TikTok, up here in the profile page. Watch the video there. If you find it helpful, please do watch the video there. If you find it helpful, get involved in the program. There's no need to struggle. It's very, very well structured, I would like to say, right? And you'll see when you get in, right? Check out the video. Hope it's helpful. Thank you to all of you guys on TikTok that have asked and commented and posted questions. We will most likely be back later this week as well to help. Thanks, guys. Thank you very much. YouTube, I'll be with you in a second. Guys, just to wrap it up here on YouTube, a few little last bits. We'll close that there. So last two questions here on YouTube, guys. And if you have any more, I would drop them in pretty quick because we're going to be wrapping it up now. AJ has said, any supplements that I would recommend? First and most important thing with regards to diet, at the end of the day, we're trying to heal. What are we trying to heal? Most of this is collagen-based tissue, and we're trying to build muscular tissue, right, in the short to medium term. So we want stuff that's going to support that process. So protein is the number one. Protein intake is going to be very important. A while ago, we did a thing with some of the members, a select few members, and one of the things I was actually astounded at was just how off the nutrition side of things was. And it doesn't need to be complex, right? Eat whole, real food where the food has a name. Avocado, broccoli, chicken, beef, right? Whatever it is. That's the first, like, just eat real food, not like Lucky Stars or whatever it is, right? It's got to be an actual real food. Prioritize protein intake first to make sure you're getting, I would suggest, around that 1.6 grams per kilogram or 1 gram per pound of body weight in terms of protein intake. And then if you're doing that consistently, which you should be, which most people aren't, and getting an appropriate amount of calories, it's no good being in like some crazy calorie deficit. That's not going to be helpful for you. Appropriate amount of maintenance calories, which is very easy nowadays with all the different trackers that you've got out there. You can freely do that probably with Google, right? Just putting your height and weight, and it'll tell you how many calories you should be having a day. If you're doing all of that, then consideration of a supplement might well be something that could be additionally helpful. One of the ones I use is the collagen one, and I find it helpful. It's got collagen, it's got glucosamine, chondroitin, and a couple of other bits and pieces in there. And my biggest comment on that is that I notice when I don't take it, that my fingers are pretty sore from jiu-jitsu. And I'm like, oh man, I haven't been taking that for a while because I ran out or whatever it is, or I left it in the clinic instead of taking it home or something like that. And I noticed that now I'm taking it again, my fingers and things don't hurt as much. So that's what I'd say there, but you are wasting money. I repeat, you are wasting money if you don't have your diet on point first from real food. Try your best to get real food. Probably actually, sorry, I should say the first supplement. The reason I didn't say it as a supplement because I don't actually consider it really a supplement. I consider it a food, would be a protein powder. If you're not getting enough protein from your diet, from whole food, and you just can't stomach another chicken breast or another piece of fish, then go and have a protein shake. Use that to bump those numbers up to hit that target. Make sure you're hitting your target every day and go from there. Starshine has said, do you do lives each Tuesday on YouTube now? Starshine, we are starting, you will see on the YouTube channel page, we've been running these lives for the last month, just over a month on YouTube, and it's something that we're going to be doing more and more of going forward. We'll have more to say on this. We've been trialing it really, to be completely honest with you, but we'll have more to say on this probably towards the end of October. So yeah, just keep an eye out. But yes, for the time being, we're going live. Like we've got the members live stream, members only live stream tomorrow, and then we're probably going to be going live Thursday or Friday this week as well. So it should be really fun, guys. I do hope that's been really helpful for you. Thanks to all of you that are still on. Sorry if you came in late and you're watching it early on. If you guys do have any comments or any questions and you're watching this after the fact, you can always still post down in the comments. I know some of you guys do. Hopefully it's been helpful for you. Those of you guys that are members, if you've got any questions, any support, get into the members area, do a post, do an update. Detail helps, right? I know sometimes people start a comment with something like, sorry about the long post, but actually the long posts often give a lot of detail, and that's actually really helpful when we're trying to help you guys, with those various bits and pieces. So please don't be shy about that. If you're getting your videos in there, please do. And if you're not a member already, I've already put a link down in the live chat, but I'll put a link in the pinned comment. If you want to learn more about the program and get involved and get help you need with your back pain, then you can check out the link down there. It links to a page on the website which has a video. The video explains a little bit more about the program. It's not too long, about 3 to 4 minutes or so. Explains a little bit more, shows you some of the stuff inside. And yeah, we look forward to welcoming you guys. Thanks for joining. Really appreciate that. Thanks for staying on. And sorry for overrunning yet again. See you next time, guys.